Hani Baragwanath Hospital is one of the health facilities selected to administer the Johnson & Johnson vaccine. 80,000 of the doses arrived last night, and healthcare workers will be the first in line to receive the jabs. But is our health system ready for this move? eNCA's Heidi Jokas is following that story for us. And are they ready?
It's a good question, Jane, and given the fact that we were unable to be at Tambo International Airport yesterday to see the arrival of the Johnson & Johnson vaccines, it poses a lot of questions as to what the plan actually is. Yesterday I thought I was going to pull my hair out because we just could not get further clarity and details as to what exactly the rollout plan is. But if one remembers, Jane, about 2 weeks ago, provinces were getting their plans ready for the rollout as they were expecting to roll out the AstraZeneca vaccine. Of course, that was put on hold by government. So it seems as though a number of hospitals are ready and have put their plan in place. All they are waiting for now is for the Department of Health to give the green light to say, here are your vaccines and this is how you need to administer them. Of course, phase 1, which is what government will undertake, includes only healthcare workers. We do know that 17 sites have been identified. Each province has about 2 sites except the Northern Cape. Just listening to what some of the experts are saying, we do know that each province will be given vaccines. The vaccine will be distributed equally, so no province will get more than another. But of course, the priority now is to inoculate all healthcare workers with this Johnson & Johnson vaccine that was received yesterday, 80,000 doses. But Jane, I just want to go through what is expected. We do know that the first 3 batches will consist of 80,000 doses, and the 4th one will consist of 60,000 doses. Once we've received 300,000 doses, which is a total of the first 4 batches, and we've able to show that we are able to administer all of them, we have the option of asking Johnson & Johnson for another 200 doses. So it seems as though Johnson & Johnson will be the preferred vaccine for now until government tries to get another vaccine that, of course, will be able to assist in terms of phase 2 and phase 3. But for now, the priority is to get all healthcare workers inoculated as they are in the front line of the pandemic.
I mean, that's fantastic news, isn't it? I'm assuming that media will be allowed to be there when the first vaccines are put into the arms, and I'm just wondering if you found out anything more about why we weren't allowed the media in South Africa when the vaccines arrived last night.
So we tried to get clarity on this. We tried to ask a number of times to the presidency, the Department of Health. We even tried to ask the airport with regards to why we are not allowed there. The details were very sketchy with regards to when the plane was actually landing. When we finally got details of when the plane was going to land, we were not allowed access into the airport. And according to GCIS, it's because of logistical purposes, so we're not entirely sure what the actual reason was as to why we weren't allowed there, but government has indicated that in terms of key vaccination events and milestones, we will be allowed to be there. We do know that today it will be a big day in the Western Cape. We know at Khayelitsha Day Hospital, healthcare workers will be inoculated there. In terms of Gauteng, Jane, where I'll be focusing together with my colleague Mangoba, we are not sure exactly what the plan is. We've been told by the 2 key hospitals, which is Hani Baragwanath Hospital and Steve Biko Academic Hospital. They have not been given any indication as to when they'll be inoculating, but they've indicated it most likely will not be today. We know the vaccine was received last night and it has been transported to the various provinces for that rollout plan. So for now, details are a bit sketchy with regards to when the various provinces will roll out the vaccine, but we are trying to keep abreast with what exactly is going on, and we'll be focusing on Gauteng quite a bit.
I can't wait to see that first picture, that first jab going into the arm. Thanks for that, Heidi.